So now we're going to talk a little bit about the diagnosis and treatment of BPH, both medical and surgical treatment. When a patient has bona fide BPH and their symptoms are more in the mild to medium range, we'll usually start with medications. There are three categories of medications. One is called the alpha blocker category, and that's like Flomax, tamsulosin. Another medication is called alprazosin. And that medication works by relaxing the muscle around the prostate. There's like a capsule and the muscles in the urethra and the bladder, and it helps to relax those and kind of almost open up the blood pressure curve a little bit and kind of let urine flow better. Another category of medication is called the 5-alpha reductase inhibitor, which the common one is Proscar or finasteride. There's another one called dutasteride. And those actually work by blocking the action of testosterone, which is what causes the gland tissue to grow larger. Patients will also be prescribed a medication called tadalafil or Cialis, which originally was prescribed to help with erections, but we also found that it helped improve urine flow much the way the Flomax, the alpha blockers do. So that kind of sums up the medical management of BPH. Now, once a patient has symptoms kind of more to the medium and severe range, usually medications are no longer going to cut it. They're not going to be good enough to treat the symptoms. And so then you look at some kind of surgical or interventional procedure. When you talk to a urologist and they're evaluating you to have a surgery done, they're usually looking at the size of your gland. And the bigger your gland, the fewer options you have. For glands that are 80 milliliters or smaller, you have a lot of options. There's something called the UroLift. Lots of patients will get the TURP, which is the transurethral resection of prostate. Lots of other procedures out there that a urologist can talk to you about. Once your gland is above 80, now you're kind of in the bigger range. So like 80 to 110, 100, 120, depending on the urologist and kind of the shape of your prostate. Then most people will perform what's called the TURP, transurethral resection of prostate. A lot of the less invasive surgical procedures are no longer kind of an option for glands in that size range. Some patients will also undergo what's called a HOLEP, Holmium laser enucleation of the prostate. Both of these procedures involve putting a rigid scope up the urethra of the penis and then either shaving out the core of the prostate or kind of with a laser kind of coring out almost all of the gland and kind of grinding up and taking the pieces out. For patients who have glands larger than say 110 or 120, then the TURP is no longer really a good option because it's hard to do an adequate job safely. And so then usually you're looking at the HOLEP procedure, which is good for even larger glands, or what's called a simple prostatectomy, where they just kind of cut you open or do a laparoscopy and take the whole gland out. Now, obviously, the more invasive you go, the more invasive the surgeries are, the higher risks they are, the longer recovery they can have, the more painful they can be. You can have bleeding, you can have infection, you may have to have a catheter for some time. Very rarely you can have other complications like incontinence where you leak urine. You can have severe bleeding requiring kind of admission to the hospital. But a lot of these procedures will have risks of impacting erectile function. So for men who are still sexually active, depending on the procedure, there can be up to a 5, 10, or 15% chance of losing your erections. So a lot of these risks or side effects of these surgical procedures are important to take into account.